come to my office, as soon as you get examined and then treatment, and when we see you are to a point that you could do exercise at home, then we decided that exercise at home does not hurt you, it will help you to recover. We give you a sheet of paper, or we email you or text you this sheet. There are basically three ways you can do therapeutic exercises: on your hand and knee, laying back, or on your face, laying down. Now there are two types: is stretching exercising and strengthening exercises. Now there are times that we will emphasize on a single exercise that we decided that is more important than other. And there are times that we decide that one of these exercises you shouldn't do due to our exam and our diagnosis, that we decide that exercise is not benefiting you, maybe even hurting you. There are also neck stretching and strengthening exercises. However, we're going to talk about them later in more detail. The least invasive exercise that you could start with people with low back that we consider the safest is you go on your hand and knee, hands directly below hip, directly below shoulder, your head, your ears should be right at your shoulder level. Relax, your neck relax. And we're starting to increase our upper back and lowering our head. And after a while, sometime at least a 7 to 20 second, pushing as best we can, we do the opposite of that. We raise our head and we lower our belly and we stretch as best we can. Also, this exercise could be done side to side at the same manner, depending on your condition. Next, you could strengthen in one arm in front of you while you maintaining your low back position and keep everything strength. At the same time, you can stretch. And then you can do the same with one of the leg behind you, strengthening one leg behind you and maintaining the same position. Now, also possible to do both at the same time, which is excellent for balancing exercise, especially between your left and right brain. However, you start with one hand and one leg, and then you progress. One simple exercise is simply lay on your back with one leg bent and the foot flat on the floor. Extend the opposite leg straight out. Relax and allow your back to feel the floor. Believe it or not, this just simply start your relaxing your back and start stretching it just by bending the knee, especially if you had a severe low back pain. Next, bend knees, lay on your back, take a deep breath, place your hand on your thigh and relax. And try to press onto the floor your back very slightly and try to get your core muscle working. Next, with knee bent, pull it toward your chest. Keep the opposite leg straight. Press your knee and low back to the floor. This is a good exercise to stretch your hip and low back muscles. As this picture shows, you can either start to pull the knee toward your chest from the top of your knee or from bottom of your knee. However, if you have a severe back pain, you can start at the very low where you can grab and you have a least pain, and then gradually move up. Next exercise is you still keep one knee bent. Press your lower back against the floor. Raise the straight leg until it levels with the bent knee or actually surpass it a little bit. And this is a great exercise to stretch your hamstrings and stretches your hip. Also, as it shows in this picture, you want to stretch your ankle as far as possible so you can stretch your calf while you're doing this exercise. Next, lay on your stomach. Raise one leg off the floor while keep the knee straight. And can stretch your sacrum and your low back, as well as a strengthening muscle for your lower back. Another one, keep your neck in a normal position. Push yourself up on your forearm away from the floor and keep hip and abdomen against the floor. And this is both stretching and strengthening exercise. Next, while you are still facing up, turn both knees to one side while you rotating your head to the opposite side. This is a stretching your lower and mid back and is a great exercise for stretching the joint. As the picture illustrates, sometimes you can even extend your arm to make it even more effective. This is one of my favorite exercises for my low back person. Next, pull both knees to your chest. And this is one of the exercises I recommend, especially to those patients that they've been bedridden for a long time and they haven't moved. This is a great stretching exercise for low back, especially if you had the low back pain that they kept you in bed for 3-4 days. This is a good one you could start doing in bed. This next exercise is really for your glute muscle. And since glute instability sometimes causes severe back pain, usually this exercise is very helpful for low back pain if it comes to pelvis rotation. So all you do basically is slowly you raise your hip forward and up. You push it upward and keep it on a straight line. Make sure your body is slowly keeps it at least for 10 to 15 seconds, even more if you could. You repeat until it's okay and is not bothering your neck and upper back. Make sure this exercise sometimes could put pressure on the neck. However, this is a really good exercise to stabilize your pelvis and your gluteal muscle. Thank you for listening and watching this video presentation. If you are not my patient and doing these exercises because you find it on YouTube, please consult your chiropractor before continuing these exercises. If you are my patient and this exercise is bothering you for some reason, please discuss it with me on your next visit. Thank you and have a healthy